Routine cleaning of CPAP or BiPAP equipment and supplies can reduce infection, increase the life of equipment, and ensure therapy is delivered effectively. Cleaning includes the CPAP or BiPAP device, humidifier, filters, water chamber, mask and headgear, adapters if needed, and tubing. For specific cleaning instructions, see the device user manual or patient education materials. As with all equipment, problems can occur when using CPAP and BiPAP devices. Let's look at 7 common problems and the steps you can take to fix them. If you get a disconnect alarm, check the patient first. Ensure the mask is on and properly sealed to their face. Check that tubing is connected and there are no leaks in or around it. Confirm that the humidifier chamber is properly placed into the machine. If the device does not turn on, check that it is plugged into a working outlet. If the ramp feature does not work, the ramp may not be set. Check comfort settings on the device or call the patient's DME provider. If the airflow is too warm, decrease the humidifier and tube temperature if they are used. Check the filters and change them if they are dirty. Make sure the device is not in direct sunlight or next to a heater source. If the patient complains that the pressure feels too high or too low, call their DME provider. The prescription or other internal settings may be incorrect. If the humidifier water runs dry during therapy, make sure the water is filled to the maximum level. Check for excessive leaking around the patient's mask and adjust and tighten if needed. Make sure the temperature in the room is not too cool or dry. If excessive water, called rainout, collects in the tubing, remove the patient's mask, turn off the device, disconnect the tubing, and then drain the water. Decrease the temperature on the humidifier or heated tubing if using. Check that a fan or heater is not blowing on the tubing. Temperature changes may increase rainout in the tubing. If you are unable to resolve a problem with the patient's CPAP or BiPAP equipment, check the device user manual, patient education, or contact the patient's DME provider.